The Andover facility is the largest long-term care facility in the state. They're licensed for 514 long-term care beds in one building and 159 in another building. As of the 15th, the census was 120 in Andover 1 and 419 in Andover 2. Last Saturday, we were notified that the facility was in need of body bags for deceased residents, and it was also reported that there were 28 bodies being stored in that facility. We immediately notified the local health department, and the public health nurse and the local health officer visited that facility at 2 a.m. Sunday morning. You may recall I shared a number of days ago that we had sent out a team. They surveyed the facility and reported back that there was appropriate staffing and PPE at that time. Additionally, they reported that they observed 5 bodies on site, and the staff reported to them that 3 bodies had been released earlier in the day. At that point, we required the facility to report daily to the local health department. We also sent them additional PPE and the names of individuals that they could call up if they needed additional staffing. The facility was required to institute their backup plan for storage of deceased at the local hospital. On the 14th, we received another complaint that more bodies were being stored. At 3 p.m. on the 14th, the local health department surveyed the facility and reported that they were short on staffing, and we additionally called up the owner of the facility and notified him of our concerns and required him to report back to us. We will be sending survey staff out to monitor the activities of this facility on a regular basis. This morning, the owner of the facility reported to me that the current staffing is solid with 12 nurses, normal is 11, and 39 CNAs, their normal is 40. Additional administrative personnel are now on site, and they have provided for additional wages to be paid for CNAs to incent them to work at the facility. The census today is 420 of 543. We're not pleased with what is going on at the Andover facility, and I will give you a full report of their statistics. 19 residents have been reported as positive for COVID-19. 2 are hospitalized. 34 residents have been identified as having flu-like symptoms. There have been 7 total deaths since April 3rd. 5 of the deaths have been due to COVID-19, and they also report 4 staff members with flu-like symptoms. Andover 2, which has a census of 419, they report 84 residents with COVID-19 positive. An additional 99 are showing respiratory symptoms. 48 staff are reporting flu-like symptoms. There have been 28 deaths since the March 30th. 14 of those deaths have been due to COVID-19. We continue to work with all of the local health officials who are monitoring long-term care facilities that have COVID-19 cases, and our department's communicable disease experts provide support to those local health departments as they respond to these outbreaks.